The short answer is yes, and we've been working very much with the federal government. So we know that there was people who were repatriated from a cruise ship off Florida just yesterday, and a number of those people returned here to British Columbia. We were part of the understanding of what was happening. These people all flew into Toronto and were assessed, and quarantine was available there. People who had no symptoms and had an adequate place where they could self-isolate and quarantine at home were allowed to return to British Columbia, and we have been in contact with our federal counterparts about being notified about all of those people, so that is in place. There are repatriation flights that are being arranged, particularly from a number of countries like India, and we are aware in the coming days. And we have been working very closely with the Public Health Agency of Canada, with the Canadian Border Services Agency, around what will happen for those people in particular. And I think it's safe to say we had some concerns that the strength of the response at all of the airports and land border crossings were not at the area, not strong enough that we yet, and so we want to look at how we can support the federal agencies in making sure that everybody is aware of the requirements when they come back. And this is one of the things that I've been talking about, how we as a community need to support those people. Things are very different from when many people left the country. Particularly, we know that many people have gone to India and other places to visit family and friends. That's a very common thing that happens, and there has been rapid changes, as we all know, in the last few weeks. So yes, we want to work with our federal counterparts to make sure that we put everything in place to support people to do what we need them to do, which is to maintain that isolation for 14 days once they come back. The other thing that I think is really important is we want people who are coming back to know that we are here to support them as well. And we know that a certain proportion of people will develop this disease while they're in quarantine, and they need to know that we're here, how to connect with us to get the medical support that they need as well. So we're putting all of that in place, and we're working very closely with our federal counterparts on that.